Let's bring in the Kano State Governor, Abdullahi Ganduje, who joins us live now to better understand the disturbing trend in Kano. Your Excellency, thank you for finding time to join us this hour. There's huge concern about the rising cases of coronavirus in Kano. But let's begin with a disturbing headline on the front page of Daily Trust this morning. It says 150 people die in Kano in 30 days, or rather in 3 days. According to the report, it says residents attributed the deaths to severe malaria, typhoid fever, infections, and other terminal illnesses. Can you confirm this figure? And what are you doing to confirm whether or not they are COVID-19 related?
Thank you very much for this, your important question and the important program. Certainly, we saw it on the front page of Daily Trust that 100 people died within 3 days. But I would like to assure you that this is not true. It's a rumor, but what is important is that we immediately swung into action. As you know that period to this moment, we do not have death register at our graveyards. But because of this information, we decided to revitalize the World Health Community Informant Structure, whereby we have people at the graveyards who are giving us information on daily basis on the number of deaths and also the causes of the deaths. And also we have environmental health officers at the graveyards who are recording this information. If I can tell you what we have discovered, just for 3 local governments, on the 7th, on the 19th, we found that there were only 3 deaths from Gwale local government. And then in Kano municipal local government, on the 19th of this month, there was only 7 deaths that were recorded. And from Kumbozo local government, there was only 3 deaths recorded. Kano is composed of, Kano Metropolitan composed of 8 mega local governments. So you can see that if you put these figures together, it does not even, you cannot even relate it to 150 that are being declared as dead. So what we are telling you is that this is a complete rumor, but now we have instituted a structure that will be getting the information on deaths on daily basis. So, of course, like you earlier mentioned,
yes,
that death could be as a result of so many other diseases, but from our own record, we have only 1 death emanating from the coronavirus disease.
Well, so even though the report itself quote certain names, undertakers, officials of cemetery in all of these local governments that you have mentioned, you're saying categorically that the figures you have is 13, right? But
Yes.
Are there plans right now to identify the causes of death at this critical time?
Well, of course, our health officials are doing that. But you know, Kano is a mega city, especially Kano Metropolitan, which is holding more than half of the population in the state. So you should expect that there is always death, you know, but we have not witnessed any increase in deaths as a result of this pandemic. So I assure you that we are doing a lot we can do in order to get the correct data all the time and to find out what are the causes of such deaths. But sadly, we have only 1 death based on the coronavirus.
All right, Mr. Governor, Kano has now recorded 60 cases of the coronavirus. 1 has been transferred to Jigawa, reducing the numbers to 59 active cases in the state in just less than 2 weeks. What exactly do you think is responsible for this huge increase in numbers?
Well, you know, first of all, Kano is a mega city, and if you look at what is happening in New York, in the United States, you see that the cases are rising. If you see what is happening in Lagos, the cases are rising. But I think what has happened here in Kano is that we must have the infection, but due to lack of testing center, Before we used to take our samples to Abuja, but now since we have a testing center, the frequency at which we submit samples is very high. That is why I think we started getting this increase in number. And you know, some of the cases are imported cases, like the two cases that we have. People came from Istanbul in Turkey, and also one case, the first case, somebody went to Abuja, went to Lagos, and came back. But what we have seen that we have started getting community transmission on this virus infection. So I think these are the causes. And we do all what we can do. We first of all took the preventive measure where we locked all our borders, but you know, since there is interstate transportation, that is a big problem. Also, we closed all our schools, the civil servants, but we discovered that the Quranic schools or the Al-Majri system, which we are dismantling now, also constituted a problem. But that one is being solved now because we are transporting thousands of Al-Majris to their respective states.
Let me ask you this very quickly, Mr. Governor.
Yeah.
You recently took the initiative of locking down Kano for an initial 7-day period. Yeah. Of course, Ramadan is around the corner. Are you planning to extend this lockdown? What has compliance been like?
I think the compliance now is very high from what we have seen right on Friday when the lockdowns started. I have to thank the people of Kano for that, and I have to ask them to continue cooperating with the government. But, you know, first of all, we have to save life. That is most important before we talk of livelihood and before we talk of any other thing. So from what we have seen, the figures are rising. So certainly there is no need to lift the lockdown now. But probably we are giving a grace period of some hours so that people will be able to do some purchases because of the Ramadan that is coming up probably on Friday. But otherwise, we continue to appeal to the people of Kano State that they should bear with us because it's more important to save life and to talk about the freedom or other livelihood that people are missing. But you know that also we have the palliative program, which will soon start distribution right from ward level, not even ward level, to polling unit level according to what we have designed.
Okay, so Mr. Governor, you recently requested for funds from the federal government to fight COVID-19. Were you able to get response from the government? Of course, bearing in mind that the price of oil is sharply falling. What are your thoughts? Are you optimistic that money is going to come from the center now?
Well, I'm optimistic. We have not got any response yet, but we are still putting pressure in our demand because really the thing is going out of hand. For example, now we are spending about 800 million on palliatives. We intended to provide palliatives to 300,000 families, but now we have to take only 50,000 families to start with across the 44 local governments of the state. We have 484 wards in the state, and we have over 8,000 polling units. And we are taking this palliative to a polling unit according to the families existing in the polling unit. And these families have been identified as the poorest of the poor. We have that record. So you can see the magnitude. But not only that, we are creating more collection centers. We have over 50 collection centers now. And since the community transmission is in the increase, I think we have to double up for this. We invited for volunteer health workers. We have over 500 volunteer health workers, doctors, nurses, pharmacists, laboratory technicians, and so. Okay. And all this, they will require some incentive for them to continue. And also, if we look at the personal protective equipment, we require it, a lot of it, for the health workers, and also even the mask.
Absolutely,
that one has to
Governor.
be provided to people.
There is no doubt
Yes,
that
yes.
these are challenging time, and Kano residents are counting on you now than ever before. We wish you the best in your endeavors. Kano State Governor Abdullahi Ganduje, thank you for sharing your thoughts with us on TVC News at 9.